Good evening, ladies. This is Folake Ogundele, your Yellow House sister. I hope we've had a stress-free day. Today, I'll be taking like 20 to 30 minutes of our time to discuss an issue that gradually becomes important to people who are 40 years and above. I hope at the end of the session it will be worth our while. Thank you very much. So, the title of our session today, this evening, is Befriending August, the Key to Escaping Dementia. Now, the question is this: who is August? Why do we need to befriend her? In fact, why do we need a key to escape dementia? It's not as if we all have dementia, do we? These are the things we'll be discussing today. But before we talk about dementia, let's talk about the first person to befriend August, and that is Alois Alzheimer. He was a German psychiatrist. He died relatively young at the age of 51 in 1915. And he had met August. August was a patient in the hospital where he used to work. He met August a year after his wife died. By that time, he had put himself really into his work. And August for him was particularly unique because she had symptoms which were like symptoms he used to see in people who were old. When he saw those patients, in his elderly patients, he would just assume that, oh, well, this is acceptable for people in their old age. But when he saw August, August was just 51 years old, and she had symptoms like his other elderly patients. So he was interested in her, and then he began to work closely with her. He began to document his findings. When August died 5 years later, in 1906, he requested for her brain and also her medical records and did a post-mortem on the brain. His findings at that post-mortem was presented by him at a conference a year later, but his writings were not found until 1995, which is almost 100 years later. His senior colleague was the one that named the disease after him. Until today, we have what we call the Alzheimer's disease, which was named after his findings. So he was the first person, like I said, who befriended August, and his findings are still relevant. They form the basis for what we use to make the diagnosis of people with Alzheimer's disease, even up till today, over 100 years after his work. So now we'll be talking about August and why she's important to us. This is August. She was a German woman, married in her lifetime. She was admitted to the hospital where Alzheimer used to work 5 years before her death. She died at the age of 56 in 1906. And the major complaint that she had was she used to say to people in response to whatever they asked her, or even when she was trying to undertake a task, and then she would say, "Ich habe mich verloren," meaning I have lost myself. I have lost myself. Another phrase she used to say was just to say, "Oh God," as a sign of helplessness. And that was the major reason why they brought her. Other reasons why they also brought her was because the family found her to have become increasingly jealous. She was unable to take care of herself, and she constituted a nuisance, so to speak, to her neighbors. Even while she was on admission at the hospital. They found out that they could not allow her to freely roam about the grounds of the hospital because she was always touching other patients who used to beat her up. And then she was always hiding things and always having problems with her memory. She was forgetful, and she would frequently lose herself even in familiar environments. So that was the reason why they brought her. These symptoms, like I said earlier, were not unique to people that Aloy had found, but it was unique to him because it started while she was young. It started while she was just about 51 years old. And she needed continuous admission till her death. Even her death was because of the continuous admission, because like I said, they could not allow her to roam about. So she was frequently tied, and she developed bed sores and had infection, which led to her death. Our case is unique because we need to understand the reasons why this illness started, and how do we prevent it in ourselves? What do we need to do to make sure that we don't end up like August? If you look at this last picture, you would see, I said it's all about the synapses. It's all about the connections in the brain. That's everything that we are. Who we are, what we stand for, our person, our personality, the way we judge things, our attitude, the way our heart functions. It's all about the connection of the brain cells. It's how well the brain cells are connected, and the integrity of the cells and the integrity of the connections. Anything that tampers with these connections is a problem. It will change who you are, who we are. And so that is what we must continue to protect until we die. It's when the cells are no longer firing that you have to declare somebody dead. And this is the problem that August had. This is the problem that as far as you grow old, you may have problems with. That is what old age and dementia is all about, protecting the connections in the brain. You can see that these brain cells that we see here, the connections, the strands are well outlined. You can see the brains connecting. You can see them joining together and firing together. They must continue to do that. When it begins to slow down, they begin to have memory problems. So how do we know when someone has memory problems? How do we know if our memory is good? Because from about the age of 40, our brain begins to slow down. Not that we become forgetful, or not that we necessarily lose cells, but the rate at which the nerves conduct information begins to slow down. And so we might start becoming a bit forgetful, which is normal. But how do we know whether this forgetfulness has become abnormal, whether it is in the range of a disease or whether it is just normal old age forgetfulness? There are some things that we could pay attention to, and that will give us a clue. When you are forgetful, and you yourself, you agree that you are forgetful, it is said that forgetfulness is normal. There are times that you are calling somebody and then you begin to call different names. You make mistakes with names. Say, oh, Folake, sorry. Oh, Buki, sorry. Shewa, sorry. If you know the person that you're calling, if you are sure that this is the person that you mean to call, even though you may make mistakes with names, it shows that your memory is good. If you enter a room and then you seem to forget why you're there, but you know that, oh, there's a reason why I came here, it's likely to be normal. Because really, for that one, it said that entering a new room, there's a phenomenon that causes you to forget why you went to the room in the first place, as long as it is not often. And then if you remember faces that are close to you, familiar faces, people that matter to you, your close relatives, and you tend to forget people that you don't see often, that's said to be normal. If you remember the dates and the significance of dates, if you remember the day, today's day, today is Tuesday, we are in the month of February, this is 2022. If you can remember things like that, but you might forget whether it's 23rd or 24th, especially when you're not working with the calendar, it's said to be normal. But by the time somebody is forgetting the dates, is forgetting the significance of the dates, forgetting the year, then there is a problem. So if you're able to manage your affairs, if you are able to plan your life, if people are not complaining, that this person is always forgetful yet keeps denying that he's forgetful. If your personality is not changing, and if your personality is changing, people will tell you. So you find that people are complaining about you. They are ever saying, they are maybe saying you are no longer outgoing, or you are becoming overly friendly, or you are becoming like a nasty person, or you're becoming almost depressed, and people keep complaining about your personality. Subtle changes though, then, and you're becoming more forgetful, that would give a clue as to if this is a disease or this is just normal forgetfulness. If you are not missing appointments, if you are not missing key dates like birth dates and things like that, then it's still normal forgetfulness. If by the time people begin to tell you, you've said this before, you've asked me this question before, and it's happening regularly on a day-to-day basis, people keep complaining that, what, you have asked me this question before, you just asked me this question, or you just told me this story, that will give you a clue. And then you will find out you are having more problems with things that happened recently than remembering things that have happened so long, so far, though so long in the past. That should get you worried, and maybe you need to go for a memory checkup. So these are the few clues to memory problems versus a disease, a dementing illness. Okay, so what is dementia? Alzheimer's disease is a type of dementia. There are different kinds of dementia, but what exactly is dementia? Dementia, for easy understanding, we can say loss of memory and loss of ability to function. Now, brain functions are definitely more than memory. You have memory, you have attention and concentration, you have calculation, you have executive functioning, which is our ability to plan and organize. So I need to do several tasks during the day. I need to take my children to school. I need to get to work. I need to cook. I need to do all these things. You need the brain to be able to tell you how to plan your time, how to organize, how to prioritize. So these are some of the things that the brain does. Apart from orientation, being aware of who you are, where you are, who people are to you, and what time of the day it is. These are the things we do with our brain. We talk with our brain. We understand what people are saying to us with our brain. That's the speech. And then we can verbalize what we are thinking. We can work every function of the brain. When there's dementia, it gets impaired, because dementia is a neurodegenerative disease. What do you mean by neurodegenerative? It means that the brain cells are degenerating. They are losing their integrity, their ability to connect. We talked about connections. So the connections are weakened. Some connections are totally lost in dementia. And so what we will find are people who are not able to remember things, who are no longer able to plan, who are always missing their ways because the orientation is not there. So they may miss their ways in familiar places. They may miss their ways in the neighborhood. There's a recent story. I think Taiwo sent it to us on this forum about a man who said his mom go missing at Yaba. So you have other elderly people who go missing sometimes because they are not able to locate themselves in their environment. You also have people who may not be able to talk well, or you give the same response to any question you ask them. They begin to forget names of people, and then they begin to forget faces, familiar faces. You ask a woman who is this person to you, is supposed to be her son, and she says, is my husband, or she says is a neighbor, or she just smiles it off because she cannot remember. And then usually, particularly for Alzheimer's, you have memory starting first, and so the person may begin to forget where they kept things and will start looking for it. Over time, you start accusing family members of stealing their things. may start getting really upset and very difficult to live with, maybe because their personality is also changing. They also lose ability to function independently. They become dependent on others. They are not able to carry out their activities of daily living. What are activities of daily living? Activities that you need to be able to do yourself from day to day to live independently, like bathing, feeding, going to the toilet, urinating, defecating, dressing, taking our bath. So you find that the people may no longer be able to do it. It may start gradually and then continues to worsen. So you might find this woman who's, because she's not able to locate the toilet, she might go to the kitchen. There was one that was actually very distressing for the family members. The man went to urinate in their pot of soup, things like that, and then dressing, they may go to the bathroom, they may just pour the water on themselves and come out without actually um, sponging their body. And over time, they may not even be able to even do anything at the bathroom. The family members have to take over. Usually, they will end up needing a carer, to do these things for them. And in the initial part, they may constitute a danger to themselves. They may put on the gas without lighting the stove. There was a woman who had to tell the husband, stop, you have to lock the kitchen, because she will go to the kitchen, she will put on the gas, and afterwards start looking for matches. So it can be dangerous. They may forget food on fire for a long time. So these are some of the changes that may start to occur, particularly for people handling money. Sometimes we need to bring in somebody to supervise their money, because especially for people maybe selling at home, they give you buy something worth 200, give them 500, they may give you change of 1,000. So calculation problems generally. And then over time, they have behavioral problems too, and personality problems. That personality begins to change, maybe from being an extrovert, they may become an introvert. They may not say a word throughout the day. Or somebody who was generally like an introvert may become talkative, over familiar with people, intrusive. Personality changes, or will just be irritable, get annoyed. It can be really overwhelming for the family. Behavioral problems, they can sleep poorly, they have a searching behavior, they're always disorganizing the house because they can't remember. They're always searching and searching, and moving things and accusing people of stealing their things. So they may become depressed. For people that have awareness that they can't remember, they may become sad and really depressed, and you see them, they sigh repeatedly, they cry, they may just talk about people who have died that they remember. Memory loss is usually more for things that are recent, so they may remember more of things that happened in their childhood than things that happened yesterday or recent years. And they may also they may hallucinate, hear voices, see things that other people cannot see. They can be very destructive. They can become very aggressive, hitting people, touching people indiscriminately. So these are the symptoms of dementia, and usually would continue over a long period of time, usually greater than 6 months to years. And in our environment, however, most times memory loss, they don't present. It's because of these behavioral problems that they present, because the behavioral problems, they cause a lot of burden to caregivers, and they are a source of concern because of stigma, because it begins to look like a frank psychiatric illness. So that's why they come to the hospital. Dementia is a raging menace. Why do we say so? Every 4 seconds, one person is diagnosed with dementia. Presently, about 40 million people worldwide are living with dementia. Dementia, we say, is a disease of the old. Not that every old person will have dementia, but dementia increases as people get older, such that in people that are about 60 years old, you have about 1 to 2% of that age group having dementia. But at the age of 80, you have 20% of them having dementia. So if you have 10 people who are 80 years and above, at the very least, 2 of them would have dementia. And dementia has a lot of economic social, implications. Because when somebody with dementia is in the family, you need to take care of the person. There needs to be somebody caring for the person financially and also attending to the physical needs. And so that is why we say dementia is very, very important. It's one of the top 10 causes of death worldwide. But aside just the number, in terms of mortality, in terms of the burden, it is the one that we are most powerless about. Very little is still known about dementia compared to other top, daily diseases. So that's why we say dementia is very common. It occurs in every race, it occurs in every uh, status of human beings. So you have it everywhere. So the easy way to understand the causes of dementia is just to look at this picture. And if you look at this picture, this man is the janitor. And if you look at him, the first part of the picture is smiling, and then the second part is just really looks like he's throwing a tantrum as if he's very angry. So with the way to just understand it is like the angry janitor is the one causing the dementia. When he's happy, he's cleaning, he's making sure everything is going on well, he's making sure there are no blockages, he's making sure that the the road for these nerves to connect is clean, is clear, is unclogged. But when he becomes very angry, maybe because of too much stress over time, maybe because of toxins, if the stress is too much, he's been cleaning and cleaning, and then when he's overwhelmed, he just starts to throw a tantrum and then begins to throw things around, begins to scatter things instead of cleaning them and arranging them, begins to scatter things, clump things together. He begins to get annoyed. He's not cleaning anywhere. He's not, arranging things again. Rather, he's scattering it. So to look at dementia and ask ourselves what is the cause, we should think about the angry janitor. So anything that can make the janitor angry, anything that can overwhelm the janitor will cause this type of cascade to occur. So what are the causes of dementia? To start with, we have the reversible causes and the irreversible causes, the treatable causes and the untreatable causes. The untreatable causes are much more than the treatable causes. The untreatable ones are about 85% that you cannot treat, meaning that you cannot reverse it. The person cannot go back to who he used to be at the beginning. But some treatable ones, like people that have vitamin deficiencies, people that just had some mild brain injury or some alcohol brain injury or some infections of the brain, which may resolve when you treat the infection, or people that have kidney problems and you may have some urea problems, and then when you treat they get better. But most often than not, you have the untreatable ones, and those are the common ones. Part of the untreatable ones is the Alzheimer's dementia, which is the commonest. It occurs in about 60 to 65% of cases. Another common one in our environment is the vascular dementias. These are the dementias that arise secondary to stroke, and you have people checking their blood pressure, checking their blood sugar. They're not checking their cholesterol. We don't check cholesterol. Cholesterol is just as bad as the blood sugar and the blood pressure. The effect is just as bad. Or people that have had stroke, and then we we say that it's partial stroke. I don't understand. Partial stroke, that word partial, it really has no meaning, because partial, just the way I see people, the way they understand it, partial means that the person does not have motor symptoms, or the motor symptoms resolve. So the person was not able to lift the hand initially, maybe within a day or two, the symptoms resolve. But the impact on the memory can be even be worse than even the one on the speech or the motor. So really, let's discard that word partial. If anybody has had stroke and the person is lucky enough for the symptoms to be resolved, you must take it serious and not just disregard the symptoms. Then you have the Lewy body dementia. It looks a lot like Parkinson's dementia. You have the frontotemporal dementia. You have different kinds of dementia. There are so many, and that would determine maybe what the cause or the features of the illness. So, if we say that dementia is a disease of the old, are we saying that everybody, as long as we get old, particularly if we are over 80 years and above, that we're all going to develop dementia? God forbid. But apart from God forbidding it, there was a study that was done in the US on nuns, about 600 of them, that forms the basis of our scientific assertion. And what exactly was the study all about? It monitored nuns throughout their lifetime, and also they did post-mortem on the brains of the ones that died. And they found essentially two things. They found two groups of people. One that had mild symptoms of dementia or no symptoms relatively. And those ones, when they checked their brain, for some of those ones, they found out that for some of them, there are the signs of dementia in the brain. I talked about clumping together, like overcooked spaghetti. You will not be able to identify individual strands, and then you have places that are clumped together. They found that those symptoms in the brain, they were mild. Now, they now found another set who had severe dementia in life. But when they checked their brains, they found that the changes in the brain they were not so significant. The brain changes were just mild to moderate. And they had severe symptoms during life. Whereas some had mild dementia during life. When they opened their brain, you could say that the brain was finished. There were the integrity of the cells were really, really bad. And so they checked their lifestyle. They went back to the books and checked their lifestyle. And they found that the ones who had mild symptoms in life, but who had significant brain changes, were the ones that led engaging lives. They were the ones always into gardening, reading books, playing music, dancing. Those were the ones that had few symptoms in life, but really bad brain changes. And so it led us to the conclusion that the way you use your brain determines a lot what happens at the end. If you are active, if you are engaging the brain, if you are doing mentally stimulating activities, the brain integrity will be maintained relatively more than the other people who will not, stimulate their brain. So that leads us to what are the risk factors and how do we prevent? Okay, so some risk factors. So if we say we are not too sure about the causes, what about risk factors? Things that will make you and I prone to having dementia. Those are memory problems, particularly as we grow older. The first thing, if you look at this last picture that I sent, is the age. The older we grow, the more the likelihood of developing dementia, such that people that are 60 years old, just about 1 to 2% of them would have dementia. But with each 5 years, the rate doubles. So by age of 80 years old, at least about 20 to 25% of people that are 80 years old will have dementia. There's no running away from it. So we say that dementia is a disease of the old. Not that every old person will have dementia, but the higher percent, the older the people are, the more the likelihood of them getting dementia. What are the other risk factors? We say something like genetics. Genetics predisposes to dementia. It runs in families, so to speak. Particularly when you find Alzheimer's particularly in a family, you may still find over time generations coming down with dementia, particularly those that have the APOE allele. That's a really technical thing, you need not bother. And then when there is a genetic risk, it's likely to occur at a younger age. compared to those that are just sporadic cases. So if there is a genetic link, if the grandmother had it, if the grandfather had it, it's likely that, and had it at the age of about, let's say 75, 78, the younger age group may start to have it from about the age of 70, 60. So that is genetics. And then we know stress. The more you engage in stress, the more you undergo stressful reactions, you are everywhere today, tomorrow, and there's that perceived level of stress. It causes so much um, reactions in the brain. There's inflammation of the brain. That's the way I can put it. And that is predisposed to having dementia. Sleep too. Anytime somebody is not sleeping, it's like poison to the brain. It's toxic to the brain. You must have good sleep, particularly night sleep. That's when your melatonin is working. That's when the growth hormone is working. That's when the restorative effect of sleep must occur. You must sleep in the night. Anytime you're not sleeping at night, you are poisoning the brain. So people that do not sleep well are likely to develop memory problems, memory disease later in life, not just problems, diseases later in life. And then people who have the metabolic syndrome. What is the metabolic syndrome? People that have hypertension, people that have cholesterol problems. Most times we don't check our cholesterol problems, our cholesterol level. We check the BP, we check the sugar, we don't check the cholesterol. So high blood pressure, cholesterol, sugar, obesity, all these heart problems, they predispose to having dementia, brain problems, forgetfulness in old age, and sometimes not even in old age. So those are essentially the things that we must consider when we consider dementia. So we must understand what we need to do if we want to grow old and not have dementia. There are things that we can be active about that will prevent dementia in us in our later years. What do we need to do? We need to stimulate our brain. Stimulating mental activity needs to come up. The first thing is, what about our physical health? Whatever is good for our body is good for our brain. So we need to make sure that physically we are fit. We need to eat right, make sure we diet right, make sure that our exercises are right. We need to engage in exercises. It's said that regular exercises, regular walking, about 30 minutes, 3 times in a week, it gives us like 4 years of good memory. So if you engage in a year of regular walking 3 times a week, 30 minutes, you will gain 4 years of good memory. That's how relevant exercise is to our mental health. And then, how do we use our brain? One of the things we need to avoid is too much stress. Too much stress is not good for us. You pile on stress, on stress, on stress. Over time, it has inflammatory effects on the brain. So avoid stress, particularly when you're younger, particularly around this age. And then make sure that you have good sleep. I've said it before, anytime we are not sleeping well is a poison to our brain. Make sure that you have good sleep. And then he said that stimulating activities, make sure you learn new things. Each year, make sure you have a plan. Learn new languages, learn how to garden, read new books. Make sure that each year you have a new hobby that you engage in and you learn. Keep learning, not the one that will stress you. That's when some people say they want to go and do PhD. No, if that is what you want, if it's going to stimulate you, please go ahead, but make sure you do new things. Learn to use your left hand if you've been using your right hand. Learn to dance, learn to listen to relaxing music, learn how to meditate, learn how to shut down the world. Learn how to be on your own and shut down the world. Relax your brain, take away all this social media and phones and everything, and shut it down, and then stimulate yourself. Learn how to read, learn how to write. Make sure that you're engaged for as long as you need to be. So why do we need to befriend August? Why do we need to know about August? Reason is, in knowing about a young woman who developed dementia, because it does happen at the age of 51. It helps us to know that we are not infallible. It helps us to know that this same thing, if you are not careful, can happen to us. It also helps us knowing fully well about August. This dementia is all around us. So it's going to create our awareness, and then we can advocate for it. We'll know how to take care of people or how to impact them positively, those that have it around us. For me, as a person, not even maybe so much as a doctor, I once had a patient. That was the first time I knew we must get to talk about this issue. And recently, I had reason to remember the patient. I had seen the patient about 8 years ago, and the man was about 54 years old. He once had stroke and he had memory problems, but he resolved, he got better. Then he traveled to the US again because he used to live in the US, the family here in Nigeria. And then there he didn't take care of himself again. He stopped using his BP drugs and he had another stroke, and that was the end. He had dementia. And we were taking care of him. He had a lot of behavioral problems. He was always aggressive, always beating the wife up, always very difficult to manage. And then one day the family, the wife saw me and said, "Doctor, is there going to be an end to this problem?" And then I was giving all these doctor replies and trying to evade and saying, all these clinical terms. And she said, "Doctor, hold on. My father-in-law had the same problem when he was 90 something, I can't remember. Well, he was 90 and above. And I took care of him for 3 years before he died. And doctor, that 3 years to me was like 30 years. Now my husband is just 54 and he has the same illness. Doctor, how many years will I have to bear this?" The pain, the burden of dementia, nobody is strong enough to bear it. We must do all that we can do to avoid it, in ourselves, in our family, everything. We must do it because the burden is really, really, really huge.